My name is Patty O'Connor. I currently work at the University Hospital and Clinics as a registered nurse. I work on the neurology floor. I am a registered nurse and I work primarily with seizure patients. These patients come in and we monitor them 24 hours for about 4 or 5 days. We take them off of their medications and we want to see where that seizure is coming from, and they do seize for us. Sometimes we can see where that seizure is coming from, and if it's successful, then sometimes we can do surgery and take that area of the brain out, and that person potentially can be seizure-free for the rest of their lives. The other type of patient that we have is the headache patients, and we give them 2 types of medications. One is Thorazine, which actually does help with headaches, and the other type of medication we give them is called DHE, which is a vasoconstrictor. A lot of headaches are caused by blood vessels dilating, and it's not so much the blood vessels dilating, but the nerves that wrap around them. So that allows the blood vessels to rest, and that usually takes about 3 or 4 days. Those are the 2 primary type of patients that we take care of. 2 things. One of the things I really like is working at the university, because it is a university hospital. It is on the cutting edge, the technology is the latest, the research is the latest, and I love working with residents. They work with you as a team. They respect the nurses. They ask us sometimes, what would you do in a situation such as this? So I enjoy working at a university hospital. The second thing I really like about my career is the fact that I am able to enter into people's lives, make a difference, and that's probably the most rewarding thing that I experienced in this job. I think this career found me. I was originally I was going to be a dental hygienist, and then I was talking to a student I was with in school, and she started talking about nursing, and it just had more choices, more variety, different things to do. You wouldn't be locked into one particular thing. And so I took a fork in the road and went for nursing. I went to a 2-year nursing program in Des Moines. It was called DNAC, which is Des Moines Area Community College. That's an interesting question. I would say I am thankful it happened this way. Before I went into college, I always had the desire to become an artist. But this job opened a whole new door for me, taught me things I never would have explored on my own. I discovered parts of myself that I didn't know existed. So, yes, I'm glad I did this. I would have went the 4-year nurses training program. I believe that nurses who have the 4-year degree have a lot more options. Working, usually 2-year nurses stay on the floors. Physically, that's pretty grueling, and if you become a 4-year, if you have a 4-year degree, there's just more options. My career personally, I'm going to be retiring. The field itself and the hospital itself will always grow and advance. With the new things that the government's got in place, I'm not sure which direction medicine's going to take and how that's going to impact nursing. But the hospital itself, I think, will do well. I have known people who always knew they wanted to be a nurse, and when they became a nurse, that's who they are and that's what they're happy. Those people, yes, do it. Otherwise, it's a lot of work, it's a lot of hours. And so I would say if you have the passion for it, go for it. Once again, well, if they can do anything in high school or whatever as far as anything medically related, such as being a nursing assistant, anything that would, build a foundation for them, be around people who are working in the field, learning a lot from them, and then, yes, finding an institution or a nursing program that's 4 years, and then develop themselves a career map. Have a plan. Plan so many years working on a medicine floor to get yourself a foundation, to build a foundation underneath you. But then think about going into management. I would say what I disliked the most was probably the opposite side of the coin of what I liked the most. What I liked the most was to be able to go into people's lives, touch people's lives, make a difference, and know that you go home feeling like you've made a difference in the world. However, this other side of the coin is you're carrying life and death on your shoulders, and you never forget that. That's probably the one burden that is the most difficult thing, and yet it's the most rewarding thing. I did see death in my career, of course. You know that you've done your very best, and you do your very best to help those around you who are losing a loved one. You accept it as part of your career, and I personally see death as part of life's process. And I always believe that there's a bigger plan. Sometimes I don't understand it, but there's a bigger plan. My reward also is finding a way of being a comfort to the family. There's no real way anyone can ever really effectively deal with death. It is hard. But you do your best, and you show love. Volunteer would be great. Any volunteer work that they could do, like the candy strippers or whatever they're called these days, anything where they'd be around the environment and they would learn so much just by hearing the conversations around them. Choosing a hospital that they would want to eventually work in, they would learn the lay of the land. They would learn how the place functions. They would learn who's boss and just how the hierarchy of the place is. They could learn so much just by going into the place that they plan to be employed at someday, and just working as a volunteer and just understanding the place and how it functions. And then also, like I said before, I would recommend them being a nursing assistant, because so much bedside care, so much assessment, they could learn right there while they're working with people, giving them baths, transporting them, taking them around. Also, they're going to see a lot of diseases and disorders pass before their eyes that they can already know, and they can hear them saying, this is this and that condition, this and this and this that happens. So they would have such a strong foundation underneath them before they even went to school. You've chosen a noble profession, and it's going to change throughout the years for you. But don't ever lose sight of the fact that you're out there helping mankind.